Welcome to this medicine masterclass on hyperparathyroidism. Hyperparathyroidism results from increased levels of parathyroid hormone secreted by the parathyroid glands, which are embedded in the thyroid tissue. Parathyroid hormone, or PTH, is secreted in response to low ionized calcium by the parathyroid glands. PTH increases calcium in a variety of ways. It induces the release of calcium and phosphate from the bones, increases calcium reabsorption from the kidneys, and stimulates the kidneys to release calcitriol, which stimulates the intestines to reabsorb calcium. Secondary hyperparathyroidism occurs in response to physiology, where low calcium levels secrete and stimulate PTH release. This can occur with chronic renal failure, low vitamin D, and drugs such as lithium and thiazide diuretics. The aim is to treat the low calcium by correcting the calcium levels and administering additional drugs such as phosphate binders. Malignant hyperparathyroidism occurs when there is a similar peptide called parathyroid hormone-related peptide, which is secreted by cancers, particularly squamous cell lung cancers, breast and renal cancers, which leads to elevated levels of calcium, but on detection of the PTH assay, this is found to be low. And this is because parathyroid hormone-related peptide is not detected on routine assays. The treatment is to correct the calcium and to determine the underlying malignancy and to see if that can be resected. Tertiary hyperparathyroidism occurs when the glands become autonomously secreting PTH. Most calcium, 99%, is stored in the bones. There's a small amount of free calcium in the serum. In chronic kidney disease, there is reduced excretion of phosphate, and this phosphate binds to the free calcium, dropping serum calcium levels. That's detected by the PTH glands, which secrete parathyroid hormone. That's a normal secondary hyperparathyroid reaction. Going further, the excess phosphate chronically impairs the enzyme 1-alpha hydroxylase, which is required to activate vitamin D. Reduced active vitamin D reduces calcium absorption from the gut and also stimulates the parathyroid hormones to secrete PTH, which is another form of secondary hyperparathyroidism. Chronically, these persistently elevated levels of PTH activate osteoclasts and osteoblasts, and in turn, the glands start to become autonomous in their secretion of parathyroid hormone. Hyperparathyroidism can be caused by a solitary adenoma or hyperplasia of all of the glands. The presentation is related to the symptoms of hypercalcemia. We use the phrase bones, moans, stones and groans. Bones relating to weak, tired bones and possibly renal osteodystrophy in more advanced tertiary hyperparathyroidism. Moans refers to the psychiatric issues of feeling depressed or tired. Stones, the propensity to develop nephrolithiasis, and groans leading to abdominal pain as a result of pancreatitis or ileus. To diagnose primary hyperparathyroidism, an elevated level of calcium with an elevated level of PTH, often associated with elevated urinary calcium levels, can make the diagnosis. To manage patients, we advise increased fluid intake, avoid drugs that can precipitate hyperparathyroidism or result in calcium retention, can provide bisphosphonates for bone protection, and can advise cinacalcet for secondary hyperparathyroidism or tertiary hyperparathyroidism and treat parathyroid carcinomas or excise the glands if all four develop hyperplasia. Thank you for attending this medicine masterclass.